Hold on, I just lose my words for a second. This is harder than I thought. I thought I'd breeze through this.
Hello.
And he thinks it's funny.
I know, I'm just a little nervous.
So I know that the reality is that this story, my story, is likely to be somewhat boring to many of you, and I always try to react accordingly by not mentioning it too often. I have had some inquiries, and I thought, why not just share my story? You guys do seem interested, and for those of you who are, this is my story.
So we're just finishing up. Dressings are going on, and she'll be on her way to the recovery room and doing very well. She's stable, and everything went fine for the operation.
The 5 words that changed my life forever: you have a brain tumor. Brought my husband Bren along. Say hi.
Hi.
He's going to help me tell the story because after my surgery, in recovery and, that first probably week after surgery, I don't remember a whole lot. And so it was, my husband and my mom with me taking care of me. And so my husband is going to he's here to help fill in those gaps for me. So thanks, honey.
You bet.
With all that said, I'm going to go ahead right in and just kind of tell you guys where this all began. Well, I was working at the time at a local hospital, which was probably about, 5 minutes from our house, honey?
Yep.
And so I was driving to work that day, and I noticed that it was like the road was kind of rocking or wavy, and I knew something wasn't right. I felt extra dizzy, more dizzy than I usually did. Something just didn't feel right, but I couldn't quite put my finger on it. And I said to my supervisor, hey, I'm not feeling very well. And before I even got all of the words out, she told me to get to the emergency room. And by the time I got to the emergency room, I was basically hyperventilating because I was just kind of freaked out, for lack of better words, because I knew something was really wrong. Something wasn't right. And that's pretty much where my story begins. Of course, with that being said, I'm going to go ahead and travel back in time a little bit, about 2 to 3 years before this happened. So I'd been seeing my usual family doctor, where I told her how I was experiencing some numbness in my forehead, mostly on this side of my forehead. She had told me that it was most likely my blood pressure, because I did have high blood pressure at the time. So she said, it's probably your blood pressure. Just take it easy. Try to relax a little bit. Well, maybe on several occasions over the course of the next year or two, I had similar incidences where I was noticing my forehead felt kind of numb. The second time I went in to see her, I had let her know that the numbness had kind of graduated down into this area. And she kind of scolded me this time, actually, and said, well, you need to learn how to relax, and, are you taking your medication, and so on and so forth. Just basically brushed it off as it was just a behavioral thing, something that I was doing to bring it on, essentially. And
I mean, you had a number of doctor's appointments in there.
quite a few.
Yeah. Well, that was just some of the symptoms that you had in the get-go. Now that we look back and reflect,
Yeah, true.
That I remember dizziness, nausea, vertigo. I mean, there are a number of times where we would go to the grocery store and we'd be walking down the aisle, and you would stop abruptly and just grab my arm and have to wait and just say, oh my gosh, I feel like I was going to pass out or fall over. And, you don't think much of it at the time, but you look back now and you're like, holy cow,
Yeah.
this was all part of that. And it was quite frequent.
Yeah, for sure. So much is hindsight, because you don't even realize you're having symptoms or that there's anything wrong until you really look back and reflect. With all that said, she basically brushed it off, and then so did I, because I kind of felt foolish after that last appointment. Wasn't really advocating for myself anymore. And then, of course, the symptoms just kind of kept getting worse, but it was a slow progression of symptoms. In the beginning, it was few and far in between. It increased in intensity and it increased in frequency as time went on.
Well, and that, not only that, but you didn't necessarily know that all the symptoms were even connected.
Well, that's true.
And so you have all these various symptoms going on, and just to major feel of frustration overall this thing and trying to figure out what's going on, why am
Yeah.
I feeling this way, why am I having this stuff, and not having any answers.
Right, exactly. And, as the symptoms got worse, of course, now let's come back to the present time in 2009 when I ended up in the emergency room. On that day, not only was did it feel like the road was swerving on me, and just, I was thinking to myself, I probably shouldn't be driving. Something's really weird and something's really wrong. But yet I drove, I drove. I remember especially the road into the hospital, it was kind of curved. And I just remember feeling so out of it, so out of sorts driving on that road. It was like just the long and winding road, and it was like it was waving. It's just really difficult to explain. But another symptom I was having when I got to the emergency room was the numbness in my forehead had slowly progressed, and I had been feeling it in my cheek area on this side of my face for probably a good maybe 8 months or so, maybe longer. It's hard to tell a timeline,
Yeah.
but it had been a while, but it had been progressing. Well, the the afternoon I went into work early, it had actually progressed down into, my neck area. And it was actually even, I felt kind of like I was choking, like I couldn't swallow well. And I felt like I was going to suffocate. And it was just a really horrible feeling, which of course that too added to the feeling of, or the hyperventilation. By the time I got to the emergency room, I was just kind of freaking out. I was scared. But honestly, what I really thought it was, I thought it was H1N1.
Yeah, you thought you were sick.
Yeah, because that's what was going around at that time. It was just, we were having a lot of cases come into the emergency room with H1N1. And so I really thought, oh my gosh, I contracted this and it's really bad and it's making me feel horrible. These poor people who are going through this, had a whole new appreciation for everyone who was dealing with H1N1. So when they brought me back into the room, the nurse came in, of course. She did some vitals. She did an EKG, actually. I just told her that I hadn't been feeling well, that I was feeling a little bit dizzy, a little out of sorts. And I just told her that, something just wasn't right, but I couldn't describe it. And then, of course, I added on to that, I think I have H1N1. It's just everybody had it. So I really thought that's what I had.
Right.
So I moved in a little bit closer just because I wanted to be closer to him. So things from there felt like kind of a whirlwind. And they performed some basic tests, like I said. And then finally, when the doctor came in, she sat down with me and asked me what was wrong. And I kind of reiterated to her what I had told the nurse. And then, it was like I could feel a sense from her, like that she cared. That may sound silly or strange, but I could feel like she was actually listening, like she cared. She wanted to hear what was going on. And she said, well, is there anything else? Is that all that's going on? And I started to cry, and I said, no, there's more. And, she perked up and she really was listening, and I could feel that, I could see it. And I said, I've talked to doctors about this and nobody seems to take me, nobody's listening to me. They keep saying it's my blood pressure. And then, she said, well, tell me what else is going on. And so I told her that, it's affecting my job. It's affecting my life, whatever's going on with me. I said, I feel like I'm going crazy. And it's how I felt. I felt like I was kind of losing it. So I work with the hospital supervisors, and what they do is they call me with information to register trauma patients. So of course you can imagine they're coming in on a chopper or on the ambulance, and they need to be registered quickly. Well, what was happening, at least what I thought at the time, what was happening was, that I thought something's wrong with the phone, or, it was like the sound was coming through. I could hear them, but by the time it reached my brain, everything was scrambled, if that makes sense. It was just like everything anybody would say was becoming really more and more scrambled. And it was like I couldn't understand anything. And so in turn, my work was suffering because I kept having to ask people to repeat things. And same thing at home.
Well, you definitely had tinnitus.
Ringing in the ear?
Yep.
A little bit, yeah. I had a little bit of ringing in the ear for sure, and that also played a part because I think that took up some of the hearing, and it was just one more obstacle, from hearing or from, knowing what they were trying to tell me, and they were growing impatient with me. People were growing impatient with me at work, and I felt really bad because I felt like I couldn't do my job, and and I didn't know why. And so I told her about the progressive numbness in my face. I told her about the fact that I was walking into the same wall in our dining room every day, every morning for sure.
And we had the coffee stains in the carpet to
Yep.
prove it.
I would have my coffee every morning, and I'd be walking from the kitchen through the dining room to get to the living room, and I would walk into the same wall every day. I knew the wall was there. I was perfectly aware that that wall was there, and it's not like I couldn't see it. It was right there, and yet I walked into the same wall every day, and it would actually hurt. I'd actually have bruises on my shoulder from walking into that wall. I would stumble a lot. Like you said, I was dizzy. Nothing was tripping me. Nothing was making me fall. I would just fall, or and then typically, like I said, I would catch myself, but not always. And it was more annoying than anything. And I thought, what is wrong with me that my balance is just so bad, And I also explained to her how difficult it was becoming for me to do my job as far as getting to patient's room. I was an inpatient registrar, and so with that, I would usually take the steps to get that exercise in instead of taking the elevator. We were in a 4-story building, and I would always take the steps. Well, that was becoming increasingly difficult for me to do because especially when I was coming down a step, but even sometimes when I was going up the steps, I would miss a step. It was like it wasn't even there. And it would just make me, it would trip me up. And it became a little bit scary actually for me to take the steps. So I ended up taking the elevator more often than not. So after explaining everything to the doctor in the emergency room, she basically just said to me, well, she did. She said to me, I don't think you're crazy. We're going to get to the bottom of this. And in that moment, it was just such a sense of relief to me that not only did somebody actually listen to what I had to say, she believed me. She didn't actually give me any inclination that she didn't believe me or that it was something that I was doing. She didn't scold me. It was just so refreshing, and I almost felt like a burden lifted off of me in that moment. Like, okay, we're gonna get this figured out. We're gonna figure out what's happening, and if anybody's gonna get to the bottom of it, it's gonna be her. The doctor no sooner left the room, and they came in and whisked me away for a CT scan. I remember coming across my supervisor in the back hallway, and she reached out, but they were practically running me over to the CT machine, and she was like, "Oh my gosh, are you okay? What's going on?" I'm like, "I don't know," because I had no idea what was happening at that moment. I really didn't know. I said, "There's CT scan. That's all I know." So they did the CT scan. Then I was brought back to the room, and the nurse came in and she said, "Is there anybody that we can call to drive you home?" And I said, "Well, I can drive home. I feel better. I'm feeling all right now. I think I can drive home." And I live literally like 5 minutes from here. And she said, "No, the doctor doesn't want you driving. She wants somebody to drive you home." And I said, "Well, I hate to bother my husband,
Yeah. And they called me, and actually you had called me earlier that day just to let me know that you were going into the emergency room, but you were kind of brushing it off. No big deal. They're probably not going to find anything. It's just going to be the sickness. And just at the same time, actually, my dad was being admitted to the emergency room for some cardiopulmonary issues that he was having. So we were kind of
Poor guy.
We were kind of prioritizing where was I going to go and spend some time. But when I got the call saying that they need somebody here to pick you up, that's when I went over right away.
Yeah. So shortly after they brought me back to the room and the nurse came in and they called my husband and, all of those things transpired, they whisked me away yet again. And they wanted to do an MRI this time. Once again, I ran into my supervisor in the hallway, and she, the concerned look on her face it made me feel really bad. And she's like, "Don't worry about tomorrow. I have your shift covered," and because I think I'd been in the ER for 5 or 6 hours at this point already. They did the MRI, brought me back to the room, and I think,
by the time
were you there when I got back? I don't remember.
Yeah, you had just gotten back, so
Okay.
when I arrived there, we were just waiting back for the results from the MRI and the CT scan from her. So I think that's when we were starting to place bets.
Yeah, so that was funny. So I really didn't think they were going to find anything. I thought for sure, I said to my husband, "They're not going to find anything," and I think he replied,
You bet?
"You want to bet?"
Yeah.
And And I was like, yeah, I do, kind of. And so don't remember what we bet. And, you know, neither here
Neither do
nor
I.
there. But we did, and I remember we even shook on it. And so shortly thereafter, the doctor came back in and with her clipboard, and she said, and these were her exact words, she said, well, the good news is you're not crazy, but the bad news is you do have a brain tumor. She let us kind of absorb that for a moment, but then she did continue on to say that they believe they know what kind of tumor it is, and it's typically benign. Not always, but typically. And so she said, you're going to want to talk to our on-call neurosurgeon. Well, we waited probably about a good half hour, and he wasn't coming. So then she came back in the room and said, Dr. So-and-so had an emergency call, and so he's not going to be able to see you tonight, but he would like to see you right away tomorrow morning. No need to make an appointment. Just walk up to the desk when you get there and let them know that you're there. They'll be expecting you. And so that's what we did. So after meeting with the neurosurgeon, he let us know that the tumor that I had could be kind of difficult to get to. It's a kind of a intricate surgery. And so he said, since we were living in Green Bay, Wisconsin at the time, and he said, you know, we really don't have surgeons in our area that are able to do this type of surgery. So since the treatment of this type of brain tumor can be complicated and it involves some significant risk, we were then pointed in the direction of a couple of surgeons and doctors down in the Madison, Wisconsin area. And I was really glad that we were, because they were phenomenal. And the reason that they pointed us in their direction was because they said that they've done the majority of these surgeries. There haven't been a lot of these surgeries done overall anywhere.
Yeah, it's a rare type of it's a rare type of tumor, and you know, the referral was to go to some place where they see this more commonly and have much more in-depth experience with it.
Right. Thank you. That's much better articulated. Exactly what he said. So they took me down to Madison, and we met with these two doctors, and they were great. I felt really confident in them, explained everything. They did a bunch of tests, a bunch more tests, another MRI. They wanted to see for themselves with their own equipment, you know, their own MRI machine. They have some special machines there too, some special equipment that they test for this specific kind of tumor. And so they did some testing, and they of course confirmed the tumor. And he said that he believed it was what they call a schwannoma, which is something that actually grows on your vestibular nerve, which is your balance nerve. So that explained a lot. And it was growing on the left side. And that also explained the facial numbness, and all of the things that I was experiencing were really coming to light in that during that time of all this testing. And we went ahead and scheduled surgery. And there was quite a few trips to Madison prior to surgery. We had a lot of different testing that they had to do. They tested my hearing, they tested my balance, they were testing all of these different things. They had to, you know, the doctors clarified again that it's a very intricate surgery. There's, you know, they're dealing with your cranial nerves, which are each about the size of a piece of hair, if not smaller. And so they stressed the importance of being really prepared for the surgery and having all the information that they needed so that they could go in there and, you know, do the fine detailed work that needed to be done to preserve, you know, my face, my hearing, all of these intricate parts that the tumor was intertwined with. And that's what it was. It was intertwined with a bunch of cranial nerves. And
Well, that's just what it does. It just grows right on the nerves.
Yeah, it grows right on the cranial nerves. Around, it kind of braids itself around the nerves, if you will. And so it's like I would think of it, when they described it to me, it made me think of like a tangle in your hair, a really bad tangle that you just can't get through and you end up just cutting out of the hair. That's what it reminded me of.
Well, and that's what makes the surgery very tricky, because it's growing on the nerve. To remove it, you have to ensure that you get it all, because if you don't, you leave one cell behind, the whole growth can come back again.
Yeah.
That's what was explained to us. So, you know, the danger there is that if you're trying to remove this, the chances of nicking the nerve or impacting the nerve are really high. And so very, very complicated, very complex surgery.
Yeah. Now we're just going to fast forward a little bit, and I just want to tell you guys that, you know, after all the testing was done, going along with the surgeon's recommendations, and we decided to go with an approach that's called the middle or mid-fossa approach. I'm going to go ahead and put links down below in the description box for you guys with a lot of this different information. So if you're interested in more detail, feel free to go ahead and take a look at those links and check it out. It's actually quite interesting, or at least it was to me. I don't know if it will be for you guys, but we decided to go with the middle fossa approach. And the reason we did that is because we went in with the hopes of being able to preserve some of my hearing. At that point, my hearing had already been impacted quite a bit.
Mm-hmm.
Of course, I didn't know that. Oh, one thing I had forgotten to mention was through all the testing, they had revealed that my tumor was heavily entwined with my facial nerve, as well as my vestibular nerve and my cochlear nerve, which is the hearing nerve. And so, they said, we're going to ask you an important question before surgery. Which would you rather lose? Would you rather lose your hearing, or would you rather lose I always feel silly because there's so many people worse off, but or would you rather lose, your facial function on that side? It would be kind of like having Bell's palsy all the time. And they said, you need to think about that and let us know. Basically the day of surgery, I think it was, let us know which you would prefer. And at the moment, of course, I didn't think either one were a very good choice. But at the same time, I was like, you know what, the tumor's going to be out. It's not malignant. It's not spreading. Now, granted, this tumor, it can kill you. It grows near the brainstem. And the reason it's a bad tumor and a difficult surgery is also because of its location. It's difficult to get to. It is, it's a very intense, intricate surgery. It's difficult to get to. It's difficult to surgically remove, and it grows slowly, but it's the location to where it grows that makes it a bad tumor, basically. But with all that said, I was just glad that it was going to be out and it's not malignant. So, I was trying to really see the glass half full and look at things in the most positive way. And of course, my immediate reaction almost was, well, I'd rather lose my hearing. If you lose the function in your face, that brings so many other issues. You get dry eye and because you typically can't close your eye. And so they have to add weights to your lids so that your eye will close. And I mean, it just brings so many other issues like eating and drinking. I mean, it's not just aesthetics. It's not just an appearance issue. And so I just want to throw that out there. It's a lot of other things. And of course, at the time, I didn't realize how difficult it would be to lose my hearing either. But still, I would still do it all over again. I would still opt for losing my hearing. Now, of course, neither one was a guarantee. I could lose both. I could lose neither. It was just in that moment they said choose, and we'll try to preserve one or the other or both, or, but we're not promising anything. And then, of course, the night before surgery, basically our immediate family, my husband Brett, my mom, my sister, 2 of my first cousins, and my aunt, and my niece, I think that was everybody, came to Madison the night before my surgery. We got a hotel room because surgery was going to be early the next morning. And so we got a hotel room. And I think, what is it, a 3-hour drive for us to Madison?
Yeah.
Yeah, so of course we weren't going to make that the next morning, and it was stressful. So we went the night before, got a hotel, and just had some fun. Everybody had dinner and stuff, and it was just fun being with everybody. We had a lot of laughs, and they really helped me to forget about what was happening. And I think in the moment I was still going through it in a daze. The whole thing went by so quickly for me, and it was just, I feel like I was in a daze because there were constant decisions to make. There was like constant things happening, trips to tests and trips and researching, and yeah, it really is a blur. It was a blur, which I think was actually a blessing, because I didn't have time to get into my head, but and really think about what was happening, that I'm going under the knife and they're cracking my skull open, and So anyway, with that said, the surgery day was quickly upon us.
Well, we had got to the hospital and we had a little bit of a wait, and then we had they had called you back for your pre-op, And as you were getting ready, they're obviously also doing some last minute tests, checking blood.
Oh, yeah.
And there was a little bit of a concern there because I think there was some concern that your platelets were low.
That's right. Platelets
and
were
if
low.
they were going to even be able to do the surgery
Because of clotting
based
issues.
on that.
Yeah.
And so, but they,
Yeah, I do remember that.
and so they have determined though that everything was good.
I think they gave me something, didn't
Yeah,
they?
they
to
gave
help
you-
with that, they
Yep.
gave me something. So,
Yep.
not a big deal.
And so then after that, we said our prayer and gave you a big kiss, and we sent you back for the surgery.
And then that's when they gave me the good stuff.
Yeah, which I think after surgery, I remember you telling us that as they're wheeling you back, and because it's a teaching hospital,
Oh, that's right.
that you're going back in there and you could see all of the interns and all the students.
Yes, see, I forgot all about that. That's why he's here. I forget a lot.
We're in the room, so that was like a big surprise for
Yes.
you.
They brought me into the operating room, and the anesthesiologist, I think, was in there, and a couple nurses. Then I don't know how many other followed, like five or six more people followed, and I was like, "Oh, is that's a lot of people?" And he goes, "Well, yeah, it takes a lot of people because they had to have the people doing the audio. I guess they check your nerves, so they had pins stuck in me, or whatever, to keep an eye on my nerves and everything. And so they had people doing that. It was quite an ordeal. They laid me down and they switched me over to the other bed, and I remember looking up and it was all glass, and I looked up and I said, "Oh wow, that's a lot of people," or something like that. And the doctor kind of chuckled and he said, "Well, that's the students anyway. They're medical students, and I guess they all wanted to watch my surgery. And before my surgery, they had asked if that would be okay." Because it's a teaching hospital, and they said, would you mind signing this so that we can let our students watch? And I'm so glad you remembered that. I forgot. And I was like, yeah, of course they can. Absolutely. I could see them all, and they were just all crowded. I know he said that was probably the most students that they'd had come to a procedure to watch, because it was something that was rare. They didn't get to see it very often, and they all really were interested. And so that was kind of cool. And then bam, I was out. Don't remember anything else. Thank goodness. And so
part of the other things is you said that they were hooking you up to test nerve function and stuff like that.
Yeah.
They also had to attach a contraption to assist them with opening up the skull.
what was it called? The 3-pin head holder or something like that?
Something like that. I just remember you having basically a mark here, a drill mark here.
They shaved my hair right here,
and-
like the widow's peak area. They shaved this back. And then I had over here, I had a bald spot on the top and a bald spot on the back, where they had this machine holds your head in place while they do the
Keeps it straight
the
and steady.
craniotomy, and but they're actually pins going in, drilled in to hold your head. I'm glad I didn't know about that before the surgery.
But you're glad that they do it, because obviously
yeah.
it keeps the head steady, and the last
Yeah.
thing you want to do is have any movement while you're under, especially for that type of surgery.
Totally.
So the surgery, from my best of my memory, it had to be about 7-8 hours long. That we had waited in the room, and then I believe they came and gave us a little bit of an update. Actually, they gave us a few updates throughout the day. Matter of fact, letting me know what stages you were at, when they were getting ready.
Okay.
And then once the procedure was done and they're wheeling you to the recovery room, that's when the doctors came and told us about the news that the surgery went well.
So we're just finishing up. The dressings are going on, and she'll be on her way to the recovery room, and doing very well. She's stable, and everything went fine for the operation. The tumor all looked benign. It did look like a schwannoma. It did come from the balance nerve. It was densely welded to the facial nerve and the hearing nerve, but those nerves look good. And the facial nerve we actually can test right at the end of surgery, and it tested normally. So that means she should have good facial function. It is very common, like we talked about, to have some temporary weakness, but based on the testing, we expect real good long-term facial function. So that was a good result. The hearing nerve we also preserved, but remember the key thing with hearing is the circulation. Right now we are getting hearing thresholds on the monitoring, even after we closed everything up. But you can have hearing thresholds on those if the circulation to the inner ear is involved and still get hearing loss. So we really won't know on the hearing until we test our hearing. We expect some degree of hearing loss. We won't know how much until we test the hearing. Obviously that test before surgery was not such a good one for hearing because it told us that the tumor was in the hearing compartment and it did extend all the way out really to where the hearing nerve goes actually into the cochlea. So, but the nerve is intact and we'll see what the hearing is in about a month or so. As soon as we removed the bone and took the pressure off the tumor, you could actually see it start to expand a little. So it's under a lot of pressure. And
everything went well, so brain stem, we didn't have any problem, unusual bleeding from the brain stem or any from any structure. You know, this is still major surgery, everything went perfect, but that doesn't guarantee anything. First we're gonna check how she's gonna wake up. Is she gonna be with it? If she's with it, is she gonna follow commands? Is she gonna move arms and legs symmetrically when we ask her? And then we will check her face and how is his facial function, how is her facial functions. Next 24 hours or so, we will watch her closely for the major complications from this craniotomy, which are we talk about the brain swelling, seizures, stroke from irritation of the blood vessels, and the bleeding. She will have MRI tomorrow to make sure everything is okay, and we will have some idea about the tumor removal too. But the main reason we are doing the MRI, the brain is okay, there is no swelling, nothing unusual on the MRI. First 2 days, I told you guys, she'll feel like she's hit by a truck. So she will feel nauseated, fatigue, tired, pain here. But eventually they will go away, and all we care now how she's gonna wake up. She's with it, she follows commands, she speaks perfect, face is okay. Then rest we can take care with the medications. Okay?
So far, so good, huh?
So far, so good. Couldn't be better than this. No news, good news next to us.
Yeah.
Okay?
Thank you so much.
Yeah, thank you.
all right, we'll see you later.
Thank you.
You're welcome.
Yeah,
Bye-bye.
thanks.
You're welcome. See you later.
Nice to meet you.
Yep, Merry Christmas. Bye-bye.
Yeah, same to you.
This is rare. I'm like,
Well, once you got out of the recovery room, the first time we really got to see you was in ICU. You had to spend the first night in ICU. And I just remember being the first one to go in there just to see how you were doing, and you were pretty much out of it, but your senses were pretty sensitive to light and to sound. So we wanted to try to keep it as very quiet as possible. But because your body was coming out of the anesthesia, you really were hot. That was one of the biggest things I remember.
I remember that,
just
and
how hot you were, and you felt like you're burning up.
I don't remember much about that time at all, which I think is probably a good thing. But I remember how I felt. And I remember sitting there feeling like somebody had sparked a fire inside my body. And there was they were trying to do all these things. I think they had fans on me. I remember the nurse. I had the best nurse. And he put a pillow under each of my arms, I think, for the cooling effect. And with cooling things under my arms, nothing had an impact. Nothing was going to extinguish that heat I was feeling from the inside. I felt like I was burning up, and
we even got the room down to like 55 degrees.
Oh yeah, you said that you couldn't even be in there, and he's like,
well
he
insulated,
likes
so.
to be. Well, you just like it to be really cold.
I do.
So for him to be cold, it was chilly in that room, but for me, I never did cool down at least that first night or two. It felt like an eternity, but it was I just remember feeling awful.
Yeah.
It was, I would not wish it on anyone. I'm glad I had it done. It's done. Things went well. But that was the most horrific recovery. It was awful.
Yeah.
It was really awful.
I think it got worse once we got you to your regular room. Once you got into the regular room, it was very difficult to. Anytime you'd open your eyes,
Yeah.
you got the immediate dizziness.
Yep. And
Um,
every time somebody came to my room, whether it was one of you guys or a doctor, it was like there was 3 of everybody. And the room would spin, and it was just, I remember not wanting to open my eyes at all. And they kind of let me keep them closed
Yep.
for the most part. They didn't try to push it. They didn't really try to, force me to do anything. I think the people who were taking care of me were experienced with this, and so they knew kind of what to expect and what I was kind of going through the best that they could without it being a firsthand experience.
You had an ENT surgeon and you had a neurosurgeon, and they each had their own teams, and they were continually coming in every few hours to check in on all of your vitals, all of your symptoms, see how you were doing with it. So, you really never got much rest while you were there, certainly for those few first days.
Yeah.
And then as time rolled by, more therapy started coming in. You had some physical therapy that you had to
that's
do.
right. Yeah.
They wanted to start do some tracking with your eyesight, and
Oh yeah, that was another thing. And actually that can still have a tendency to be an issue now, even now, but only when I'm really tired or maybe extra stressed, or my eyes have difficulty tracking. I don't know how to explain that. It's hard to explain. I'm not even sure how to explain it, but they don't track. They don't move together. And so it just compounded the dizziness too. And, my head was pounding. I had pretty much the worst headache I've ever had in my life after surgery. I remember that. The facial paralysis came, but it wasn't bad. It wasn't
temporary.
It was temporary. They said, they believed that even though they had to basically scrape the tumor off of my facial nerve, they really thought that not only did they think they got it all, they also felt felt like they were able to preserve it pretty well, though there is a weakness there. Like I have some weakness on this side. Whistling, for example, whistling is harder for me now. It's not a lot of weakness. I think it's undetectable for most people, unnoticeable, unless you're looking for it. Of course, I notice it. I noticed my face kind of dropped a little bit on that side. My facial symmetry changed after surgery. Well, even like you guys probably won't be able to tell, but after the surgery, it feels kind of like minced meat in here. It never really went down. The swelling on the main part of my surgical site really went down. It kind of sunk in a little bit, but this part almost feels like chopped meat or like ground meat or something in there. And so now when I put my glasses on, this side's still real comfortable, but this side always hurts because it's pressing harder on that side because it sticks out more. But it's like I said, it's really changes that most people would never even notice. I notice them naturally.
And so I think recovery in the hospital went really well. And about after 7 days is when we got to bring you home. That first week at home was another rough stint for you because part of what you needed to do was to sleep more upright. So we had to make a bed for you downstairs in the living room off the couch off of our sectional. I can't remember the angle, but you had to be upright.
Yeah, I had to basically sit up, like I'm sitting on a straight chair.
Yeah, and definitely you were restricted from bending over, couldn't bend over,
Yep.
Shouldn't be lifting anything, those types of things.
That's harder than you guys might think. If you've never had that kind of restriction, it's really hard to sleep in an upright position like that all night and not be uncomfortable. It was really hard on the hips. My hips would ache. There's only so many ways that I could sit or lay. So we tried the chair. I'd go from the chair to the couch, but I just had to not only sit upright, my head had to stay up. I couldn't, right? Couldn't have my head down in any way. Because of swelling, I'm guessing, or
Yep.
I don't know.
Well, and well, and the other thing too was that you were on a pretty regimented post-op medication schedule. Every few hours, you were having to take certain medications, and probably the one that probably had the biggest effect on you was the prednisone in a negative way, because here's a medicine that's supposed to help with recovery,
Inflammation.
and pain and all of those things, but yet also made you very much wired.
Oh,
And so here
kept me up all night.
So here we were thinking we're going to have you down for the night and you're going to be resting, and your mom and I would be resting. We'd find you at 2:00 in the morning in the kitchen and sweeping.
I remember sweeping one night, and I felt like I was out of my, like, I didn't even realize what I was doing. I just knew that, I think my mom came in there. Or did both of you come in there?
Came in there, we're like, what are you doing? You know,
I was sweeping the kitchen floor, and they, scolded me, luckily, because I really was out of it.
But you did really, really well with doing your home-based physical therapy. You had to, we take for granted just some of the simple exercises, like, just tossing a little ball back and forth. Well, that was part of her therapy, just, again, for tracking and, spatial awareness as part of recovery. But, she was excellent with, doing that very religiously.
I had to do eye exercises and that. And I remember going in for physical therapy, or it was called vestibular therapy, for my balance. I had to go in, and they had this machine that you were in. It was quite interesting, actually, and that was helpful too.
Yeah. So we had follow-up appointments, and I just remember that one of the first appointments we went back there was for them to do a post-test on your for your hearing.
Oh,
and
yeah.
that was when we kind of knew, but then it was the true validation that you had lost hearing in your right ear. Left ear.
They had thought they may have preserved some of my hearing, but unfortunately the tumor was a little bigger than they thought initially, and it was really compressed in there. It was really under a lot of pressure, they said, and so it had been really pressing on those nerves, and so it had already affected their function, their the blood flow to those nerves, and so because of the pressure, so my face was already affected a little bit before the surgery because of that, as well as my hearing and naturally my balance. So,
but I think probably the biggest thing is in light of that one loss, we feel pretty blessed for the outcome of this.
Well, and then I had a couple of MRIs that first year following surgery, and I've had an MRI every year in the following 6 years, right? Once a year for the following 6 years, and then now I've had what they call a clean MRI, and so I haven't had one since 2000. I had one when we were here, so
Is it 16?
2016 I think was my last one, and that was also clean, and so I feel incredibly blessed. They did an amazing job. Losing my hearing, of course, has posed different challenges than I would have expected. Of course, you don't really know what to expect, right? But I didn't expect the challenges that I have faced with that. Of course, I'm always, I know that things could always be worse, but dealing with it has been a little bit challenging. I mean, they call it single-sided deafness, and they call it SSD. I'll put a link down below if you want to, read up a little bit more about some of the challenges. You can't tell where sound is coming from, and that presents a challenge within itself. I've always been what they call a social butterfly. I meet people everywhere I go. I love talking with people and just being part of the community and having, going out with friends and family, and that's definitely been hindered, that part of my life, because not only is it exhausting for me to be in a noisy room, a noisy setting, it's also really difficult for me to visit. I can't really be part of the conversation if there's other noises in the room, because that takes up my good hearing, and so
everything's competing for that.
Everything's competing, and it's really difficult to explain. But like I said, if you want to read more, go ahead. I'd love to educate people on that, because there's a lot of people that do suffer from that, not necessarily from a brain tumor, but for different reasons, and it's a hard thing to deal with at times, because people don't understand, nor how would they? I didn't know before I lost the hearing. I didn't know. But of course, I'm very protective of my good ear. And we really don't go see movies anymore because it's so loud in the theater. Even with a little earplug in my good ear, it's so loud, and I'm always afraid I'm going to lose hearing in that ear. So in my good ear, so I'm very careful. What else, honey?
Well, I think that, of the things that you mentioned, memory loss is still an issue that, it's almost like the short-term memory loss has been impacted the most.
Definitely.
It's easy for her or for you to get twisted and turned around, confused
Yes.
by things, and it leads to frustration for you.
And for people around me too at times, which I can understand.
Yep. And I think it's also impacted, just from having brain surgery, is just at times different moods, and how you respond to certain situations.
Oh, definitely.
Before the tumor and then after the tumor removal.
Oh, there's definite differences. I mean, and a lot of people will say, well, there shouldn't be. Everything's fine. It's out. You're fine. But I think anytime they crack your skull open, as my surgeon would say, that's what the neurosurgeon always said.
Yeah.
Anytime they crack your skull open, there's going to be some changes.
So when you look at all of those things, ultimately what I see is it's impacted about how she approaches daily life. Can be even just confidence in certain situations, or just going into to environments, like you said, where all that noise is coming on there, and it just takes a lot of mental capacity to focus and leaving
So
those.
much energy.
And so, in terms of choosing to go to defense or not, and I think that's a big thing that even I lose sight of from time to time. That her deficiencies are real. Your deficiencies are real. You can't see them, and I think that goes for a lot of other people. I mean, how many times since you've had the surgery where I've gone to whisper in your ear and I've
Always in this ear, the bad ear, always.
whispered in the wrong ear to her just because you forget.
Yeah.
But these deficiencies you just don't see, and you don't.
But how would anybody know?
How would you know?
When I was working at the hospital, I ended up going back to work about 3 months after the surgery, not because I was well enough to really go back necessarily, but because my time off had run out, and I had the most amazing manager ever, and she really helped me to, get every single minute that I could, off from work, for which I was incredibly grateful. But, going back to work was a huge struggle. It was really difficult.
Yep.
Just organizing my thoughts. Even now, almost 10 years later, December will be 10 years since my surgery, and organizing my thoughts. I forget things. I was in the car one day, and I had put the car in park, and then I needed to go. I needed to put it back in drive, but I looked down at the shifter, and it's an automatic, and I couldn't remember how to. It's like I looked at it, and I may as well have been looking at a piece of machinery that I'd never seen before and didn't know what it did. I couldn't remember what to do with it. Like, how do I knew I needed to go. It's really difficult to explain, and I'm sure some of you have been there at different times. It's really frightening to feel that way, to feel like you don't know where you are, you don't know which way to go. I lose my sense of direction. Just, I have so much difficulty organizing my thoughts now, and it can really be taxing. It's some of the simpler tasks, or things that used to be simple for me, are much more exhausting now, really exhausting. And so they will continue now. Every 5 years I'll have an MRI, every 5 years, just to double check, and, to make sure there isn't any more tumors, making an appearance. So they'll keep testing for that. I have phenomenal doctors. My one neurosurgeon, he checks in on me every single year, sometimes twice a year, to see how I'm doing. He's just so, they're wonderful. They were wonderful, and I feel really blessed that for the most part, my deficiencies are very, very small, and of course, naturally, in the scheme of life, and looking at what some of these other people are dealing with, especially young children and anybody, dealing with adversity, it's, I feel incredibly blessed. I feel like I got really lucky, and of course there's always a silver lining, at least I think, and there's lessons learned along the way, and I think that what we went through strengthened us as well.
Yep, for
Going
sure.
through that together, and of course my mom was a huge help. My mom was just always there. She stayed with us for 2 weeks or 3 weeks, taking care of me while he had to work, and that was just amazing. My mom she's a really good nurse. And yeah, just they took care of me because I really didn't know what I was doing. It was kind of rough, but it took a long time to recover, though. It really took a long time. Some days I feel like I'm still recovering, just trying to continue to build upon the balance issue. The doctor said a lot of times other cranial nerves will help to facilitate those actions, for the nerves that are gone, that they had to take out with the tumor or what have you. And all in all, I feel pretty blessed. I don't know. I'm trying to think if there's anything that we didn't touch upon. I mean, that's pretty much it in a nutshell. And I guess what I want to say is, for anybody else out there who's facing something like this, whether you're dealing with a malignancy or what have you, just stay strong, and you will.
And you're not alone.
Yeah.
There are plenty of people that are out there that will be happy to help.
Yeah. I mean, and if anybody has a tumor like I did, or you want to talk with somebody who has been there, who's experienced it, even if our paths are different in other ways, if things aren't always going to be exactly the same, but I'm always happy to help. I'm happy to answer any questions that you guys have. And I wanted to, this video began because of my little bit of scar here. Had several people ask me if I'd had plastic surgery because of my scar. This is the tail end of my scar. And, I haven't. It was the tumor, it was my from my craniotomy, just the residual. And that's about all you can really see unless I pull my hair apart or move my hair alongside and you can see. But I do have an implant. Speaking of that, with my hearing loss, I ended up getting what's called a BAHA, bone anchored hearing aid, or
Yes.
something like that. And so I do have a large,
Post.
I call it a bolt, like Frankenstein bolt. I just need one on the other side. But anyway, it's a post, and it's in my skull. So I'll probably just go ahead and make a video on that and show you guys how that all works, and tell you a little bit about that story too. And yeah. So I think that's everything, you guys. Like I said, if you've been here this long and heard my story, thank you so much for staying around and listening. And I hope that you enjoyed this video for what it's worth. And if you did, give it a thumbs up. Love to hear from you guys down in the comments section, of course. There's some, I'm going to post one of my, what do you call it, my incision, a picture of my incision, and it's a little so if you don't like that stuff, then you might want to stop now.
There's your disclaimer.
There's your disclaimer. You might want to stop watching now, because I know that does bother some people, so just be aware of that. Stick around if you want to see some video footage and some pictures. Again, gonna put the disclaimer out there. It's kind of icky. So it's a little icky, but if you're okay with that, then then keep going, and I'll see you guys in the next video. Thanks for watching. Bye.
Bye.
let me know if you start feeling there's some pressure off, okay? That feels good.